More than 70 warrior medics of the Picatinny Arsenal, New Jersey-based 7245th Medical Support Unit and 7358th Veterinary Detachment, as well as the Newark, Delaware-based 7221st MSU and the Louisville, Kentucky-based 7356 VD took part in Innovative Readiness Training Mobile, Washington, or MOWA, Choctaw Wellness Real-World Medical Mission in Mount Vernon, Alabama from June 1st through June 15. Lieutenant Colonel Vivian Annan, the IRT mission officer in charge, said the soldiers provided medical, dental, optometry, and veterinary services to the population of the MOWA Choctaw Indian Reservation.
The purpose of the mission is really to provide medical, dental, veterinary, and optometry care to an underserved community in this area. And the end state really is to leave something back for the community.
Annan said the mission is a joint interagency effort between the Army Reserve Medical Command, Delta Regional Authority, and the MOWA Choctaw Indian Reservation, and said the operation is compartmentalized into specialized teams.
The medical unit basically takes care of blood pressure monitoring, glucose monitoring, medication management, and preventive health care. So what we do is a lot of education in terms of getting mammograms, colonoscopies, prostate exams, pap smears. And then the veterinary, they're doing a lot of wellness checks for the animals in the area. They're doing spays, neuters, and also vaccinations.
Sergeant Aaron Kuyun, a patient administration specialist with the 7245th MSU, said the IRT provided soldiers with new career-enriching experiences.
One of the neat things here is, number one, interacting with folks from other units and other disciplines that we may or may not get to normally interact with. And I think another cool thing is a lot of our soldiers have been able to do things even on a little bit outside their MOS. All sorts of things that we don't even normally do in our normal pad world, but because we're here and all working together, we're able to get that experience.
Captain Jose Medina, a family medicine physician with the 7221st MSU, said he and other soldiers are grateful for the opportunity to serve the underserved community.
I think everybody's really enjoying the opportunity to serve in uniform and practice their craft that they do in the civilian world in this setting, to sit down and have conversations with members of the reservation and the surrounding communities, trying to play a small part in connecting them to care, connecting them to resources, learning what's available out in this community, figuring out what the needs of our patients are and kind of connecting the two. I think that's been a worthwhile experience, not just for me, but for everyone here.
Staff Sergeant Jeffrey Reed, a dental assistant with the 7221st MSU, said all the soldiers were happy to be there to make a difference.
Something that I would like to say to the people here is that we're happy to be here serving your community. We're happy to provide a helping hand and our medical expertise and knowledge to help the wonderful people of this area. It's a blessing that we can do this for the folks here.
Reporting for the Army Reserve, Sergeant First Class Christopher Hernandez, Mount Vernon, Alabama.